my name is Dr. Pardis Hosseinzadeh. I'm a double board certified reproductive endocrinologist and obstetrician gynecologist, and I'm an assistant professor in the Department of Gynecology and Obstetrics at Johns Hopkins University. I also serve as the director of the PCOS Center. Today, I want to challenge how we think about PCOS and explore how earlier recognition and prevention-focused care could change the trajectory of health for millions of women. PCOS is the most common endocrine disorder in reproductive age women and affects about 5 to 10% of women globally. Despite its prevalence, it's frequently underdiagnosed or diagnosed years after symptoms begin. Traditionally, PCOS has been viewed primarily as a fertility disorder. However, we now understand that it's a lifelong metabolic and endocrine condition with implications far beyond reproduction. Many patients begin experiencing symptoms of PCOS during adolescence or early adulthood. These may include irregular or absent periods, acne, excess hair growth, or difficulty maintaining weight. Unfortunately, these symptoms are often attributed to stress, puberty, or lifestyle factors. Because of this, diagnosis may be delayed by several years. The most widely used diagnostic framework is the Rotterdam criteria. Based on the Rotterdam criteria, we diagnose PCOS if someone has 2 of the 3 following criteria, with number 1 being irregular cycles or having ovulatory dysfunction. Number 2, if someone's presenting with symptoms of elevated androgens, including facial hair growth or acne, or having elevated androgens on their blood check. Third criteria is having polycystic appearing ovaries on the ultrasound. So as I mentioned, we diagnose PCOS if someone has 2 of these 3 criteria, but that is if we have excluded all other causes, including thyroid disorders, adrenal gland disorders, some pituitary disorders, and also androgen-producing cysts of the ovary. It is so important to know that PCOS is a heterogeneous condition, meaning patients may present with different combinations of this symptom. The biology of PCOS involves multiple interacting pathways. Insulin resistance and hyperinsulinemia play a central role, contributing to increased androgen production and disruptions in hypothalamic pituitary ovarian signaling. These pathways reinforce each other and help explain the chronic nature of PCOS. So PCOS is not just a reproductive disorder. Patients face higher risk of type 2 diabetes, metabolic syndrome, dyslipidemia, and early onset cardiovascular disease. They also have an increased risk of endometrial hyperplasia and cancer of the uterus due to chronic anovulation. Recognizing PCOS early provides an opportunity to address these risks. One of the most important opportunities in PCOS care is prevention. Early diagnosis allows early intervention, which includes lifestyle modification and optimization, such as healthy nutrition, regular physical activity, and weight management. Lifestyle modifications are still the cornerstone of PCOS treatment. Even a small weight loss of approximately 5 to 10% of body weight can significantly improve metabolic and reproductive outcomes. We have medications and medical therapies that can address both metabolic and reproductive aspects of PCOS, one of which include metformin. Metformin is commonly known as a diabetes medication, and it can improve insulin sensitivity and metabolic parameters and result in regular ovulation in some women. Hormonal therapies such as the combined oral contraceptives or progesterone-only measures can be used to regulate menstrual cycles and protect the endometrium. Anti-androgen therapies help treat hirsutism and acne. More recently, the GLP-1 receptor agonists have shown promise in the PCOS population to help with weight management, metabolic optimization, and resuming regular cycles. PCOS also affects mental health. Patients experience higher rates of anxiety, depression, and body image concerns. Stigma around symptoms such as weight gain or excess hair growth may delay care seeking. Comprehensive PCOS care must include attention to emotional well-being. PCOS should be viewed as a lifelong condition rather than a temporary reproductive issue. Management should focus on metabolic health, reproductive planning, and preventive care. A multidisciplinary approach can help patients maintain health throughout their lifespan. This is the prevention framework for PCOS. As I mentioned, early recognition helps with early introduction of lifestyle optimization measures. And then these patients will be followed with metabolic monitoring of their reproductive health. In summary, PCOS is a lifelong cardiometabolic condition. Early identification allows us to intervene earlier and reduce long-term health risks. By focusing on prevention and delivering multidisciplinary integrated care, we can improve both metabolic and reproductive outcomes. The earlier we recognize PCOS, the more lives we can change. In summary, PCOS is a lifelong cardiometabolic disease. The earlier we diagnose the disease, the earlier we are able to intervene and help reduce the long-term health risks. Here at the Johns Hopkins Multidisciplinary PCOS Center, we specialize in providing multifaceted care to your patients with PCOS.